Because the treatment of the surgeries is to prevent the curve progressions. So in general, we divide the kids into the two categories, right? One is matured, skeletal matured, one is not matured. So in general, if skeletal matured, the curve more than 45 degrees, we offer a surgery. But for skeletal immature, if the curve is large and then there's a potential of further progress, and the kids has further progression in the growth, we do something called growing rod system. So there are different modalities of scoliosis surgery. But in general, most of the patients come to us after close to maturity. So we follow the general rule, 45 degrees above, we do surgery.
One of the biggest problem is progression of the curve. If the curve is big enough and is progressive, and we do nothing is done, the curve will continue to increase. So imagine if the curve increase to 90 degrees or even 100 degrees, it's going to cause a lot of discomfort to patient, number one. And furthermore, this also will cause disturbance to the functions of the internal organs like the lungs, heart. So all this can happen much later in their life. But the problem is if you allow this thing to happen and they are much older, the curves is much bigger and the bones are much more stiffer, and the whole thing is going to be very much more complicated. The risk of surgery will be much higher. So we don't like that to happen. Yeah. So usually, if the risk of progression is high, we definitely want to arrest much earlier.
The biggest risk that in fact, the patient and the surgeon have been aware of is a nerve injury, right? So nerve injury can happen in two ways. One is that when they're putting in the screw in the inexperienced hands, the screw can actually go into the nerve area, and that can cause a nerve injury. And not only in the inexperienced hands, sometimes some patient has a very, very small bone. The bone is so tiny, it could be just about 2 to 3 millimeters, and we have to put in a 3 to 4 millimeters size of screws. So thanks to the technology nowadays, we can actually do screws under navigations, and in the future, soon we're going to acquire the robotic surgeries, robotic arm to help us to put the screw much more accurate than the freehand techniques. And the second condition that can cause a nerve injury is overcorrection, because when the spine is bent or tilted, the spinal cord is actually shortened. So when we do the surgery, we actually lengthen the whole spine. As we can see in Ms. Fang's case, we lengthened her by 4 centimeters. We have done cases where we lengthen the patient height by 8 to 9 centimeters. So when lengthened too much, actually can cause a spinal cord traction and injury. So in that way, we actually use something called neural monitoring system. So even though patient is under GA, we still can monitor the function of the muscles, the integrity of the nerve to the muscles. So if there's any insult to the spinal cord or nerve, we can actually pick up from the muscle signal. So that actually cut down a lot of the nerve injury after surgery. And second thing that can happen during surgery is a blood loss. Let's say in a difficult case, we do take long hours to do surgery. It can be actually controlled by giving patient transfusion. But in Sunway here, we actually use something called self-saver. So it's a machine where we suck out all the lost blood, put through a filters, and then after filter, the blood are being sent back to the patient. So patients have their own original blood back to their body.
From the discussion just now, we know the earlier we pick up the scoliosis, the better. Yeah. If the curve is small, if you can arrest the progression, that's the best. If really need to go for surgery, if you can operate when the curve is not too big, it's better. So awareness is very important. Thanks to the public awareness, we are seeing more parents bringing their children for checkups when they are not sure whether their children have scoliosis or not. So I think this helped a lot. So we are seeing less major curves nowadays. Yeah, I think Dr. Lim and Dr. Saw will agree.
I think many parents, when detected scoliosis, they go to, we call it other kind of the treatment, such as chiropractors, the massage, or sometimes they go to physiotherapists directly. It's an acceptable way, let's say for small curve, but please do not ignore the doctor part. The doctor actually need to monitor the curve, right? Because sometimes the doctor has a better way to actually make sure the scoliosis curve accurately, and then we have a better understanding about the growth potential, so we can counsel them what to watch, when to watch out. And sometimes, in addition to doing this chiropractor treatment, physiotherapy, the patient also need to be on the brace, and when to start the brace, when to remove the brace. Actually, the doctor understands it better, right? So I think the treatment can be from both sides, right? It can be from either the physio, chiropractor, and also doctor. If you have scoliosis and you haven't consulted any surgeon, any doctors, please come forward to any doctors to have a word. Not necessarily that you must agree on the surgery, okay? Because if you meet a good doctor, which will tell you what are the pros and cons of surgery, and whether you are willing to go through the risk, okay? And don't just run away, move away, hide away from the doctors, right? We are there to help you, to guide you. We are not there to just simply cut the patient up, right?
This is just the same point Dr. Saw mentioned just now. I just want to say it again because it's very important. For parents who are not accepting surgery because of certain reasons, please don't just run away. We would not stop you from trying other alternative treatment, but please do come back for follow-up. Because once you notice the result of the alternative treatment is not satisfying, we still can help and intervene. Do not just disappear and come back 5 years or 10 years later when the situation is much more complicated. That's important.
What makes the surgery safe, which is very important, would be a team of good consultants. And like in Sunway, Dr. Saw, Dr. Lau, and myself work in a team. Yeah, and like Dr. Saw said, we use technologies such as 𝗟𝗶𝗆 and also intraoperative neuromonitoring. This would further ensure patient safety. And the upcoming technologies such as navigation and robotics, we're going to embrace it to make it a safer surgery for all. So I'd say we strive to make scoliosis surgery a safe surgery for all.